Hello, today I will be talking to you about a quantitative correlated study on the impact of patient satisfaction on a rural hospital. My name is Savannah Worley. First on the agenda is to summarize the introduction and background sections. Then I will be explaining the purpose of the study, listing my research questions, discussing the theoretical and conceptual framework in the article, discuss how sampling was performed, detail how the study participants were recruited, detail how the data collection instrument was used, describe how data was collected, discuss how the data analysis was done, summarize the results, summarize the discussion, answer the research question, discuss the study limitations, and state the conclusion. To begin, healthcare is a team effort. Each healthcare provider plays an important role on promoting a high quality of care for patients, not only physically, but mentally. The allied health departments generally generate 75 to 80% of hospital revenue. Therefore, with this said, research evidence suggests that there is a strong positive relationship between an allied professional's ability to increase patient satisfaction and the gross revenue generated for hospitals when this satisfaction is increased. In 2012, hospitals that received Medicare payments were required to participate in patient satisfaction surveys, which could potentially decrease reimbursement if the hospitals failed to meet the expected benchmark determined by CMS. In a rural health care facility, revenue primarily results from inpatient stays in allied departments, more specifically in laboratory and radiology services. Healthcare consumers in the geographical region could influence the financial success. The rural hospital used to describe this relationship was located in northeastern Oklahoma. The purpose of the study was to describe a relationship between rural allied healthcare mean consumer satisfaction scores and allied healthcare departments' generation for revenue for a hospital. The research question was, is the relationship, if any exists, between an allied healthcare practitioner's customer service skills and hospital revenue? The theoretical and conceptual framework behind the study was derived from the simple concept that consumer satisfaction directly relates to the gross revenue on goods and services. The method behind the study was sampled through analyzing 25 months of historical patient satisfaction survey mean scores and revenue statements. The nature of recruitment involved healthcare customers admitted into the emergency department in inpatient areas, and the staff that was provided to care for these patients. Data was collected through computing the Pearson's correlation test between the monthly measures of revenue and the various satisfaction rates for the emergency department and inpatient areas. The current study analyzed data in the form of figures and tables. Here are the results. Table 1 presents descriptive statistics consisting of the mean, standard deviation, and range for hospital gross revenue, and for each of these satisfaction rates for the emergency department and inpatient categories. Table 2 represents the revenue was positively significant correlated with the 3 satisfaction ratings from the emergency department. Table 3 contains the correlation for the inpatient satisfaction ratings. None of the correlations between revenue and inpatient ratings achieved significance. The trend tended to be the same in the direction as the emergency department ratings, such that all of the correlations were positive with the exception of the waiting rating. This correlation displayed a negative number, however, was small and deemed insignificant. The findings indicate the null hypothesis was rejected in the emergency department setting, but the null was not rejected in the inpatient setting. This result was concluded through analyzing monthly measures of revenue and various satisfaction rates varying from department. Table 2 displays positively significant correlation with the 3 satisfaction ratings from the emergency department. These areas include standard testing, a courtesy of patient-performed blood collection, and courtesy of radiology personnel. Table 3 revealed that between revenue and inpatient settings, nothing was achieved. In conclusion, The focus of allied health professionals must be on taking care of a patient's health completely and providing the best customer service, with the exception of inpatient setting areas. The study answered the research question, what is the relationship, if any, exists between an allied health professional's customer service skills and revenue, revealing that hospital emergency departments' gross revenue is related to mean patient satisfaction scores. However, the study is limited due to the fact that seasonal factors have a huge role in hospital revenue. It is difficult to determine if revenue decreased during the holidays due to customer satisfaction or a decrease in patient visits. This limitation is a recommendation for the future for researchers to take into account. Here are the references listed for this research. Thank you all for listening.